not have a complete civil registration and vital statistics. And therefore, we do not have correct numbers or accurate numbers of births and deaths, and also to know the causes of deaths in a particular population, in this case a sample. And that's why it's really important to have a system that can help us to document such.
We're really looking at how can we think about how each of your teams is going to develop a robust, integrated, fit-for-context sample registration system.
SRS conference has a bit of history. We started last year in Zambia, and after this workshop in Zambia, we were invited to submit a proposal for the assessment of mortality data sources in Tanzania. So Tanzania was among the 6 countries that received this grant. We started implementation last October 2024. At this juncture, it was a point for us to present the results of this assessment, which we did during this conference.
There is a lot of gaps when you think about programming, when you think about policy formulation, when you also think about whether we are actually answering the equity question. And so implementing a mortality surveillance system like an SRS is a stopgap measure, because one of the things that it would allow us to be able to do is basically to address some of these gaps and then also create a platform where we can nest other activities to be able to collect complete data.
Avec la mise en œuvre de ce système SRS, cela va nous permettre, pour une première fois, donc, de faire communiquer les dispositifs ou bien les sous-systèmes qui existent à travers une interopérabilité entre le secteur de l'état civil, mais également le secteur de la santé.
So SRS is coming in to help us obtain this kind of data, which is very important for policy making, and not just that, also tracking SDGs, and as well as even tracking our population health.
We are going to have good quality but also timely data on these births and deaths, but also be able to calculate some of the statistics, our mortality rates, and also know the causes of deaths in the population.
There's a lot of a wealth of experience in the room, which is not easy to find, and so it has opened our minds to learning and to ensure that our countries are not making errors of countries that began before us. Now this time we have a chance for Kenya to do it right from the word go.
The experience during this conference has been very enriching. There are countries that are already in the implementation phase of the SRS, and therefore it was a good opportunity for us to hear and learn from the implementation from these other countries, because it also helps us to refine and shape the proposals that we will be submitting to the funding agency, which is in this case the Gates Foundation.
Gotten the opportunity in person to continue to expand my networks, continue to have a much deeper understanding of what the SRS intend to do for the individual countries, and then also to understand the nuances across different countries. So how Ghana is seeing an SRS is extremely different from how Pakistan, for instance, is seeing it. And the way we all are thinking about implementing it is slightly different, you know. And so it's more of a learning experience. It's more of one that expands your networks and then puts you in a better state to be able to support other countries.
One of the big things that I'm taking home as a key takeaway is actually resource mobilization. That one, as the conversations we've had in this meeting, has really opened our minds on how to go about stakeholder coordination, both government and development partners in the field of mortality surveillance. The second is the role of a strong coordination mechanism. I think we are not factored or figured it very well, but now listening to other countries, that has become quite clear that the next steps as we live here is to go and have a proper coordination mechanism in place. Besides that is the issue of system integration. The conversations we've had on ICT also very eye-opening, and also we intend to give that a further step when we go back to our country on integrating our ICT systems.
Nous pensons que le SRS est une réalité qui peut être applicable dans le contexte du Mali. Avec la collaboration avec les pays qui ont déjà mis en œuvre et la collaboration interne dans les pays en impliquant tous les acteurs clés, on pourrait mettre dans un délai raisonnable les CRSS.
if we do not design our SRS with the sustainability lens in mind, then we might fail at some point. And therefore, stressing on sustainability and who we need to engage in the process, who really matters from the very beginning, to make sure that this entity or these people are involved, for them to understand why we need the SRS.
It's not an easy journey, so we have to be confident on whatever the plan that we are making. The very important thing is that we have to look at the resources in a very programmatic way, and we have to chip in with the right people. We have to, do multiple kind of engagements. That's where we are lagging.
The Viva, that presentation that was done was extremely helpful, because you get to know that, okay, all that you need to do, all the tools are available, so that's a big takeaway. Number two issues, discussions around sustainability and resource mobilization is extremely important. And so we have brainstormed a couple of ideas, but the discussion in there was super helpful, so that is another thing. And then the third one has to do with the final expectations of the grant awards. What are the expectations? How do we move towards that to be able to achieve?
So I would like to call on our stakeholders, both government, to come on board and participate, and not just participate, we want them to invest in SRS, because we were looking for quality data, which is real-time, which we lack in our mortality surveillance space, in our CRVS system, and we really want to urge our partners and stakeholders to come on board and help us to get this data, which is very important, again, for planning and decision-making for government.
Les CRS est une réalité et c'est un outil qui permet aussi de prendre des décisions sur des bases factuelles en termes de mortalité au sein de la population. Comme vous le savez, cette année, la dernière EDS au Mali n'a pas pu donner des informations sur les décès maternels. Je crois qu'à travers les CRS, ces résultats pourraient être partagés et montrés au-delà de l'EDS que nous avons raté. Nous avons d'autres moyens de pouvoir rattraper les gaps qui ont été laissés par l'EDS que nous avons fait. Et
it is very important for the stakeholders to prioritize mortality surveillance and also registering their births. It is a good case of investment, and I think this should be prioritized and invested in, and there should be a commitment to the use of it. And the more we use, the more we understand the value of the data, and more we understand the quality of the data.
No, I think it's extremely important for all stakeholders to come to the table. First of all, to appreciate the importance of having complete mortality data, and then also translating that data into actionable policies.
I think to make this a reality in Tanzania and other countries, I think we should not leave anyone behind, meaning all the stakeholders, from the people in the community that we will be probably interviewing, to the officials who will be running the analysis, disseminating the information. I think we really need to engage all the different people along the way.
I want to appreciate our organizers, the organizers of this function. Honestly, I know a lot has gone into it, and we really appreciate that they took time to know the right people to be in the room, to even know the various disciplines, from people who are very savvy in ICT, to resource mobilization, to countries that have experience in SRS. Basically, everything we needed was here for SRS planning. For countries that are at my level, where Kenya is, we appreciate that they went a step further to ensure we have all this information, and we're really grateful. And we're looking forward to many more. It goes towards capacity building of the people that we have in the conference, and how we go back and share the knowledge in our country. So, it's just a small group, it's the entire country that benefits when we have this kind of conference.